Good day, folks. Thank you for joining us here at Your Health. On today's program, we have a very special guest. Dr. Leslie Ray Matthews joins us. Dr. Matthews is a trauma surgeon, and he gives his trauma patients high doses of vitamin D to assist in their recovery. And he is getting dramatic results, and he has come to talk about that today. Trauma, vitamin D. It's amazing what happens when you have enough of the sunshine vitamin. That's our program for today. Stay tuned for that. First, let's go to our news. Let's see what's happening in the health world. America's lack of leisure time physical activity is driving up the cost of health care. Researchers from Florida Atlantic University find that 36% of all Americans do not exercise in their spare time. This practice leads to elevated health care costs. The lack of exercise accounts for 22% of all heart disease, 22% of all colon cancers, 18% of all osteoporosis-related fractures. All totaled, America's poor exercise habits raises health care costs by over $24 billion every year. A study was published in the American Journal of Medicine. Many people are unsure of what type of exercise they should do. They ask, well, should I join a gym or buy expensive exercise equipment? Now, most of the health benefits provided by exercise can be obtained by walking just 20 to 30 minutes most days of the week. There are added benefits to lifting weights, running, and doing exercises like yoga or Tai Chi, and I encourage you to do as much as you can. But at the very least, walk at a brisk pace most days of the week. Our persistent avoidance of exercise is costing us big money, folks, some $24 billion in added healthcare costs every year. Plus, it's adding to our sufferings. 22% of all heart disease and colon cancer, 18% of osteoporosis-related fractures, 12% of all diabetes and hypertension, and 5% of all breast cancer is directly related to our refusal to exercise. Whenever I talk about the benefits of exercise, I'm reminded of a man who suffered a disabling and paralyzing injury that confined him to a wheelchair. He told me that exercise is not so much a responsibility, but rather a privilege, and it should be nurtured and engaged in frequently for best results. Teens who have suffered a traumatic brain injury are more likely to regularly consume energy drinks. Researchers from St. Michael's Hospital evaluated the health histories and dietary patterns of 10,000 athletes ages 11 to 20. They found the young athletes that had suffered a concussion or traumatic brain injury within the last year were 7 times more likely to have consumed 5 or more energy drinks within the last week. They were also twice as likely to have mixed alcohol with an energy drink within the last year. Folks, when young people engage in physical exercise, play, and competitive sports, it's a good thing. However, when a young athlete incurs closed head trauma and a concussion or traumatic brain injury results, it can lead to permanent brain damage, especially if the young athlete returns to play too soon and is injured again. The challenge has always been in determining who has a more serious injury requiring extended recovery and who has just received a minor bump to the head that will resolve quickly on its own. Now, better field-side concussion diagnosing techniques are being developed, but we still primarily rely on the athlete's behavior to determine whether they have a more serious head injury or not. This is exactly why this study is so important. When a young athlete consumes larger numbers of energy drinks, it may be a sign that they have had a significant head injury and they require extended recovery time. It's like this, folks. People drink energy drinks because they provide a temporary boost of mood and alertness while they enhance mental and physical states. Plus, they provide large amounts of sugar, which causes a dopamine release and energy to burn. And all of this temporarily soothes an ailing, traumatized brain. Bottom line, if your young athlete is drinking energy drinks, pay attention. It may be a sign of head injury. And we'll have more on the treatment advances of traumatic brain injury later in the program. Having a low vitamin D level may accelerate the mental decline of aging. Researchers from the University of California, Davis and Rutgers University evaluated 400 seniors over 5 years. They found overall 61% of the subjects had suboptimal vitamin D blood levels. Those with lower levels of vitamin D showed accelerated cognitive decline and impaired performance. The researchers report the mental decline observed in the patients with low vitamin D levels was profound and rapid. Over the 5 years of the study, the mental decline of the vitamin D deficient patients was 2 to 5 times faster than the vitamin D sufficient group. Well, folks, I think we've learned The brain needs vitamin D. And when vitamin D levels drop, the brain ages faster than it needs to. The brain also needs vitamin D to heal from the traumas of everyday life and from extreme traumas such as traumatic brain injury. Now, this study is remarkable. Over the 5 years of the study, those with low vitamin D levels experience cognitive decline 2 to 3 times faster than those with adequate levels. Over the past 15 years, we've reported on over 250 vitamin D studies, and what we have learned is astounding. But there is more. Today on Your Health, we will take a slightly different approach on our discussion of vitamin D. Today, Dr. Leslie Ray Matthews joins us. Dr. Matthews is an associate professor of trauma surgery at Morehouse School of Medicine, and he is fascinated with vitamin D just as we are. Dr. Matthews has been conducting vitamin D research on trauma patients, and he would like to share his firsthand knowledge with us today. Today's Your Health is very special. Please stay tuned to learn more.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Welcome back, everyone. We're so honored to have Dr. Leslie Ray Matthews with us today. Dr. Matthews has an impressive list of credentials. He received his medical degree from the University of Mississippi, his residency in surgery from the Morehouse School of Medicine, and a fellowship in critical care at the Mayo Clinic. Dr. Matthews is currently a full-time faculty member at the Morehouse School of Medicine in Atlanta, Georgia. He's also the Associate Professor of Clinical Surgery and Director of Surgical Critical Care. Not only is Dr. Matthews a highly acclaimed trauma surgeon, but he's highly interested in vitamin D, nutrition, and is a man of faith. Welcome, Dr. Matthews. Thank you for coming all the way to Texas to be with us today.
Thank you for having me.
I can't wait to have a discussion with you on vitamin D. It's definitely one of our passions as well.
Okay.
Thank you for joining us, Dr. Matthews.
Thanks for having me.
It's a real honor to have you with us. You know, surgeons are primarily concerned about when to operate and what procedure to use and the technical nature of things. And I'm not used to hearing from a surgeon that vitamin D is important in recovery. How did you develop this interest? Give us a background into this.
Okay, to give you a little bit about my background, I was a chemistry major in college, so I view the body as a big chemical factory. Everything in the body is a chemical reaction.
I'm with you on that.
Yes.
I was a chemistry major too, so we're talking the same language.
Okay.
Go ahead.
And so as a result, vitamins are just spark plugs. They just make a reaction go at a lower temperature and make them go faster. So vitamins are limited in the things that they can do. The thing that sparked my interest in vitamin D was vitamin D is a hormone. It's not a vitamin per se. It's a true steroid hormone. Hormones basically control how we interact with our environment and how we handle stress. So if you can learn to use this or manipulate vitamin D, you can do a lot of things that can benefit the public.
So would it be safe to say a hormone is an adaptive mechanism? So it helps us deal with stresses.
Yes, it does.
And vitamin D would do that, wouldn't it?
Yes, it would. Vitamin D controls 3,000 out of 30,000 genes in the human body. So it also controls your immune response and your inflammatory response system. So as a surgeon, if I can control the immune inflammatory response system, imagine the things that I can do.
Absolutely. Your formal education in nutrition, I was trained under the same system as you, and they didn't teach us a lot about nutrition. How did you become interested in nutrition?
I think my education in medical school, we had 3 lectures in nutrition. My mom was always into just natural products and supplements, and she's 91 years old, still doing well and still mentally alert. And so I learned a lot from my mom just watching her.
Yeah. You know, that's exactly how I got started in this too, learning from my mother and senior relatives. It was important to them, and so I picked that up too.
Yes.
Let's talk about vitamin D. Now, you have a depth of experience that you just can't get from a research paper. This is first-hand knowledge.
Yes.
Let's talk a little bit about what you've learned about vitamin D.
Okay. I've learned that there are a lot of, like I said, it's a hormone instead of a true vitamin. I've learned that you can use it to stimulate the immune system. Actually, what I've noticed with vitamin D, when you supplement patients with high doses of vitamin D, your CD4 count, which is a T cell or immune response cell, actually goes up. So it increases the CD4 level, and it downregulates inflammatory response. So we look at C-reactive protein, which is a cytokine or a molecule that basically causes your blood vessels to become leaky and causes chronic inflammation. It decreases that.
So you applied this in acute care.
Yes, I did.
Tell us about some of the studies you've done.
Okay, the first paper we published, the federal government says that 30 nanograms per milliliter is a normal vitamin D level. However, if you look at nature, most animals run between 50 and 55.
Really?
Yes.
Okay.
And so I think Mother Nature is a lot smarter than humans.
There you go.
And so then in my graft, we challenged the level of 30. The reason we did that because there are certain physiologic responses that happen above 30.
Yes.
At 30 nanograms per milliliter, then you get to 40 nanograms per milliliter, you get maximal muscle contraction. You also get maximum bone density at 40 nanograms. And then your PTH level is inversely responsive to your vitamin D level.
Parathyroid?
Parathyroid, yeah, I'm sorry, parathyroid.
No, that's all right, parathyroid hormone.
And so your parathyroid hormone nators at 40. And then at 50, you get maximal stimulation of your immune response and maximal suppression of your inflammatory response. So that's why 30 cannot be normal.
So we have these varying initiations of physiologic processes as vitamin D increases. Is this common knowledge in medicine, or are we on the cutting edge now?
We're on the cutting edge. Think of vitamin D like you would dopamine.
Okay.
Dopamine at different concentrations does different things. You know, at a lower concentration, it stimulates the dopaminergic receptors, and then at a higher concentration, it stimulates the beta receptors. Then even at a higher concentration, it stimulates the alpha receptors.
Okay.
And so vitamin D does the same thing. So the first response is to make sure you can locomote or move. So basically, the first thing, vitamin D has a higher receptor level at the bone density level. That's bone health is important. So after you get above 30 and 40, then it starts stimulating the immune system. So at different concentration, it does different things.
Okay, let's create a scenario here. Let's say I'm working on a construction crew and I'm crushed by heavy equipment. I'm still alive,
Yes.
but I am hanging by a thread.
Okay.
What do I need from vitamin D? What does it do for me in that traumatic experience? Talk about that.
Okay, in a trauma situation or acute illness situation, when you come in the hospital, we have you in these dark dungeons, as I call them.
Yeah, there's no vitamin D being made there.
None at all, and because it's not natural light. And so in the first 24 hours, your vitamin D level decreases 50% just from trauma or stress alone.
So you start burning up vitamin D,
you start
essentially.
burning it up faster.
Okay.
So if your level is 30 nanograms per milliliter when you come in, it's actually going to drop down to 15. So you actually need to give them higher levels. And then in the trauma population, you got to think about volume of distribution of the amount of fluids that's on board. We give patients a lot of fluids because they're bleeding, they're they're hypertensive, they're septic. So actually that patient is not the same weight and size. So normal traditional doses won't work at that level with these a trauma type patient. So we notice they need higher levels or higher dosages.
So my routine daily dose of 3,000, 2,000, 4,000, that's not nearly enough in trauma.
No.
How much do they, how much would you give a typical patient?
We use up to 50,000, sometimes daily, and depends on
50,000 every day?
Yeah, sometimes depending on how high we need to do to get the levels up to a certain level.
We wouldn't want to do that when I'm well and healthy. And
No.
eventually I'd become toxic, right,
Well,
at 50,000?
Yes, you would. Well, if you keep taking it too much and stuff. So, but we've perfected this technique because we started in our ICU patients.
And you keep
So,
close track of
monitoring.
everything, so
Yes.
you know. But at 50,000, you found essentially miracles can happen. Can you tell us a little bit about one of your studies was heart attack.
Yes.
Tell us about heart attack and vitamin D.
Okay, well, we know now that 50% of heart attacks occur in patients with normal normal cholesterol.
Sure.
Yeah, so cholesterol cannot be the culprit in all heart attacks and stuff. Even though people on Lipitor, some people still have heart attacks.
Yeah.
And so chronic inflammation, if you notice, New England Journal of Medicine released an article saying elevated C-reactive protein, there are 2 to 3 more times more likely to have a heart attack.
Inflammation drives heart disease.
Yes.
Okay.
So chronic inflammation is a culprit in almost all chronic diseases that we know now. So it's a chronic inflammation, and cholesterol and calcium are basically dump molecules that are trying to plug up leaky vessels.
Okay, all right. So vitamin D administered to the heart attack patient, they recover much faster.
Well, I have to be careful the way I word this. Vitamin D only decreases chronic inflammation. It regulates or modulates chronic inflammation. So you can't say vitamin D treat heart attacks. You have to say it just decreases the chronic inflammation that can potentially cause a heart attack.
But as you followed in a published study, people who are admitted to intensive care for a heart attack, you give them high-dose vitamin D, they're better off with it.
We've cut our incidence of heart attacks and strokes and other chronic diseases. We've cut our mortality rate. Our outcomes are better. And so, yeah, we've seen significant improvement with high-dose vitamin D.
Yeah. Folks, our country is facing a healthcare crisis in the form of added expense. Have your healthcare premiums increased in the last year or two? Ours have, unbelievably high levels. When we return from these important messages, we want to get Dr. Matthews' opinion on how we could save a lot of money in this country. That's when we return.
Time is here again with our annual Cancer-Free Celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Welcome back, everyone. We're having a fascinating discussion today with Dr. Leslie Ray Matthews about nutrition, healing, trauma. This is just amazing information. Well, Dr. Matthews, you've studied a lot. I mean, your whole career, you've studied the human body and the healing and crisis management, etc. You've learned a lot about vitamin D and healing, which is just fascinating to me that a surgeon, and not only a surgeon, but a trauma surgeon, would take the time to really study the body and see how this all miraculously works together, and using the nutrients that God gave us to heal. And I think it's fascinating that both of you doctors learn from amazing mothers.
Yes, we do.
And that just, doesn't it just bring it home, everyone, the importance of our mothers in our life and how much we can pass on to our children? At any rate, your studies, fast forwarding to now, and Richard was talking about how expensive health care is, et cetera, and we know that heart disease is the #1 killer in America. It's huge.
Yes,
heart disease is huge. Anything that we can do to help prevent heart disease, to help treat heart disease, and save healthcare dollars at the same time.
Okay.
What did you find in your studies?
Well, first of all, I'd like to preface it by saying I'm not a cardiologist. I'm a trauma surgeon, as you said. And so a trauma surgeon is just basically a person that can cut, that knows internal medicine. In order to be a trauma surgeon, I think you need to be versatile. You know, we see patients from all walks of life and all ages. So we have to know a variety of different things. Cardiac disease, we have a lot of geriatric patients on our service. And so after they're in major accidents, they have heart attacks and strokes.
Right.
So basically that prolongs the hospitalization, prolonged ICU care, prolonged time on the ventilator.
And suffering.
And suffering.
Yes.
And it's very expensive. A typical bed at Grady costs about, ICU bed costs about $4,000 a day.
That's just the flat rate.
Just a flat rate.
You have a meal and it goes up,
Yes.
right?
Yeah, you can get a 5-star hotel for $300 a night.
Yes.
And so I often joke at Grady, I tell people, if I ever get injured, take me to Grady, stabilize me, then send me to Ritz-Carlton down the street because it's cheaper.
Yeah,
a ventilator costs about $1,500 a day. So if you're on the ventilator, that's $1,500 a day. Then if you have kidney failure, renal dialysis is about $1,250 a day. So it can add up to over $10,000 a day for ICU care, which can be very expensive.
Wow.
And we've often had patients in the unit for months and weeks. And so I'm always working on how can I improve care, how can I make things better. So as I stated earlier, the thing that vitamin D does, it decreases chronic inflammation. And we know that there are over 100 different diseases associated with chronic inflammation: heart disease, cardiovascular disease, autoimmune diseases. And so vitamin D is a hormone. It regulates those genes that controls chronic inflammation. So if I can decrease the chronic inflammation in your body, I should be able to decrease the incidence and the severity of these very severe diseases.
Mm-hmm. So you developed a study. You designed a study to determine what happens when a person who has a heart attack comes into critical care, and you give them large doses of vitamin D every day. What'd you find out when we did this?
We cut our heart attack rate by 50%, and we cut the number of days that they stay in the ICU. In 2014, we had our first heart attack for the whole year in September. You know, from January until September.
And this is a major medical center with a lot of patients.
We're one of the busiest trauma centers in the country. And so we've significantly cut our stroke rate, heart attack rate, and then when our patients come back to clinic, they've recovered. They've recovered most of their function.
How much vitamin D did you give them in a time of crisis?
We use a 50,000, and we use very large doses and stuff because, as I stated earlier, first 24 hours your level drops 50%. And then you have to get your levels up higher enough in order to combat chronic inflammation.
You know, I think, Richard, that's one of the things that most of us don't understand, and that is that our vitamin D drops.
Yes.
We think once we get our level up, it's going to stay there as long as we're supplementing. But you're saying, no, when you have illness or whatever, you know, trauma, it's just depletes.
Well, it's just like driving your car. You fill your gas tank up. You can't fill your gas tank up one time. You have to fill your gas tank up every week. So after you get your level up, you have to take maintenance levels in order to keep it up.
But that you lose it when you have trauma.
Yes, you do. And so then you need larger doses.
You know, Doctor, I'm familiar with, there is a bit of a rivalry between surgery and internal medicine. We're always going back and forth, and it's good-natured mostly.
Yes, it is.
But there's some competition there. How did the folks in internal medicine respond, the cardiologists and whatnot, when you, a surgeon, finds that vitamin D can help the cardiology patients? Were they kind of, or were they, this is interesting, let's talk more? How'd they react?
Well, actually, I've had more resistance from the surgeons than I did the cardiologists. Yes, I did. The cardiologists, after they saw results and the patients getting better, a lot of them are actually checking vitamin D levels now, the ones that I know. And surgery is kind of, well, most of my colleagues have just surgery as a cut type mentality, and they don't understand that vitamin D can decrease their wound infection rate, their urinary tract infections, pneumonias, shorten the time on the ventilator, and cut the amount of narcotics. They did a study at Mayo Clinic and found that most people with chronic pain have low vitamin D levels. You get the vitamin D level up to normal, you can cut their narcotic use by 50%. We spend over $350 billion a year just on narcotics alone.
And kids are abusing it, and others are abusing it, because we have to give out so much to people.
Yes, we do. And we've also noticed, well, I have not done an official study on this, but patients that I've had that were like narcotic problems, actually once we got the vitamin D level up, you see them back in clinic, they're not asking for a lot of narcotics now.
Isn't this amazing?
Yes, yes it is.
You have also focused on head trauma. Of course, as a trauma surgeon, concussions and traumatic brain injuries. You also work with the Army. You've worked with the Army with helping with...
I've met with some military generals and kind of educated them on vitamin D, how it can help. In the military, the big problem that they have is that most kids that come in the military at 18 have stress fractures. And so the military spends over $200 million a year on stress fractures and rehab and surgery and lost hours with these new recruits and stuff. You know, they have these 80-pound sacks on. And
well, it's stressful. It's stressful. And if their bones aren't maximum strength, they get these problems.
They get these problems.
And is vitamin D and nutrition related?
Yeah, it's a worldwide problem. You know, there are over, according to the New England Journal of Medicine, Dr. Michael Hollick's study, there are over 1 billion people that are vitamin D deficient in the world. And I think that's a...
Why are we so deficient in vitamin D?
We're deficient because of our present lifestyle. 50 years ago, everybody played outdoors. We had recess,
worked outdoors,
outdoors. And school, first through 12th grade, you took PE, you were outdoors.
I was as a kid.
And
it was
we
my
didn't
best subject.
Yes, yeah. And we're an indoor society now, so nobody goes outdoors, and then we use sunscreen. So I need to preface this. So with the dermatologist, we've made a compromise. You know, go outside 15 minutes, then put your sunscreen on so you don't get skin cancer. So I have to say that you have to worry about skin cancer too.
Yeah, we don't want to have another problem.
Sure.
So why is there so much resistance? We know so much about vitamin D, and yet there's so much resistance. I don't understand that.
Well, I read a book that it says it takes an average of 13 years when something is 100% true before it becomes standard of care in medicine. Doctors are usually very resistant. And the only person that likes change is a baby. The diapers change.
That's funny.
And so doctors, even when they know something is true, they usually rely on what they learned in medical school.
Yes.
And like you stated earlier, nutrition is not taught that much in medical school.
Well, maybe that needs to change, Doctor.
Yes, it does.
And you're training doctors. Are you including that more and more in your training of the young doctors?
Yes, they hear vitamin D talks all the time. They've actually used it at the end of the year when they're doing skits on doctors. They have me in their skits with a vitamin D.
Vitamin D, doctor. Well, that's something. Wow. Well, folks, we have important messages coming, but there will be more with Dr. Matthews in just a minute. We'll be right back.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. Fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Welcome back, everyone. If you're just joining us, welcome. We are having a fascinating discussion today with Dr. Leslie Ray Matthews. He comes to us from Atlanta, Georgia. He is a trauma surgeon. I'm telling you, his list of credentials is so impressive. He really knows his material, and you know what? He's a man of faith, a man of God, and a man of nutrition and vitamin D. This is just great information. Dr. Matthews, we were talking before the break about brain trauma. I know that you see this as part of what you do. I myself had a really devastating car accident when I was a young person, and if I had known about vitamin D then, what it could have saved me, I know it would have just been, it would have made a lot of difference in my own healing. But at any rate, you've studied this. What have you found about brain trauma and nutrition and vitamin D?
Well, years ago, I did not really like traumatic brain injury because we didn't have a lot to offer patients.
What
and
can you do?
We couldn't do a lot.
Pray for them, about all you can do.
Yeah, that's all you could do. And so after I started doing research with vitamin D, we noticed that our patients on the high-dose vitamin D start waking up, coming off the ventilators faster, and recovering most of their function with few side effects. And so we learned that vitamin D basically, remember I told you, it controls your immune response and your inflammatory response. So the first thing that happens when you get a brain injury, your brain swells. And so as it swells, you start losing neurons or nerve cells.
Pressure, it kills
pressure that kills the
Okay.
cells.
Yeah.
So if you can get that pressure or that swelling down and limit or modulate the chronic inflammation, maybe you can preserve those
Now,
cells.
haven't doctors traditionally used steroids to reduce that swelling?
Yes, well, in the past a little, but not so much now.
Not so much now,
And
okay.
but vitamin D is one of the strongest anti-inflammatory agents on the planet.
Without side effects?
Without side effects.
Right, that's the good part.
That's the good part about it.
So you're adding this to the head trauma. What are you learning?
Yes, we are. Well, our head trauma patients, we've cut our mortality rate down to 6.6% with penetrating and blunt trauma included in that. Our patients are waking up. Most of them are actually getting back to normal function. For example, we have one young lady after severe head trauma, DAI, which is diffuse axonal injury. Most of these patients can't really function. 50% of them die at the scene. Another 47% of them have chronic long-term disability, and 3% may get back to kind of like a cerebral palsy-like type picture. Most of our patients that make it out there, we have kids back in college, they're straight A students doing well now. And so we work very hard with them. We have the people put them in like dyslexia type like lectures and classes, and give them a little extra time, but they're doing very well. They're confident. They're not causing the federal government a lot of money. They're independent. And so versus being in a nursing home where they're causing society.
And so you set up a study and compared vitamin D treatment versus no vitamin D treatment.
Yes.
Or you have a protocol. Tell us
we
your
have
protocol.
A protocol. Well, we use vitamin D high dose, like I say, which decreases inflammation. So that's the first thing you have to do is decrease inflammation. We use omega-3 fatty acids because this also works well with vitamin D by decreasing inflammation. And 30% of your brain is made out of
cell membranes. You got to get that back, and absolutely.
30% of your brain is fish oil.
So fish oil, vitamin D, and then
we use glutamine, which is amino acid.
Help us heal. Help you heal.
Help you heal.
All right.
And we use progesterone, which potentiates.
Now, see, that caught my attention. Tell me, what's the thinking on progesterone with brain trauma?
Progesterone basically protects the neurons or keep them from dying, and it works well with the vitamin D and stuff. And so it's a combination. Most people have tried to do like a one-drug thing.
Oh, sure, the wonder drug. If we can find that, that's great. But it's not. Life's not like that. Our body doesn't work that way.
It doesn't work that way. Just like you can't control most people's blood pressure with one drug. Most people are diabetic with one drug. So what makes you think you control the most complicated organ in the body with one drug?
Yeah, you can't do it.
You can't do it.
So this is remarkable, the difference when we have the nutrition we need.
Yes. Well, my philosophy is that the body will heal itself if you give it what it needs. And stuff.
Absolutely.
So we're not all smart. The body's a lot smarter than we are.
You know, I'm impressed that there's something more than your mother. Now, I'm sure she was a good woman, no doubt about it. But you walk with the Spirit, don't you?
Yes. Well,
Tell us about your background here.
I'm the youngest of 11 children, and I'm from a long line of ministers. My dad was a Baptist minister. My uncle was a Baptist minister. He was president of the Mississippi Baptist Convention. He was vice president of the National Baptist Convention. I had an uncle that was a college chaplain. My brother is a minister, and so there's a long line of ministers in my family. So yes, I grew up a Baptist and grew up in the church. Had to go to church every Sunday.
What does that experience give you in the halls of a hospital, dealing with people who are fighting for their life? What's the difference for you?
Well, actually, I don't try to influence or put my religion on anybody, but, personally, I pray every day myself and pray for guidance, pray for, knowledge, wisdom, understanding. So you pray, God will show you things.
I've learned that to be true.
And then you just show you a lot of things that you just be amazed.
Do you think the Holy Spirit has pushed you along with your research, kind of helping you, guide you a little bit?
Yeah, I mean, if you want to know what's going on, you go to the person that made the body.
Yeah.
And so he can show you things that you don't know.
That's beautiful, Doctor. Yeah. Can we go to our break now? Let's do that. We'll be back in just a moment, folks. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Here is our hope for you today. I'm Cindy Becker. Do you feel that you'll never really be joyful and happy in your life? The Reverend Billy Graham wrote about these two emotions, joy and happiness. Dr. Graham says, joy is not the same as happiness, although they may overlap. Happiness depends on circumstances. Joy depends on God. In Psalm 30, David, whose life seemed an endless battle, experienced joy despite his problems as king of Israel. David wrote, "You turned my wailing into dancing. You removed my sackcloth and clothed me with joy, that my heart may sing to you and not be silent." If you are struggling to find joy in your life, pray to God. Count your blessings. Joy depends on God. I'm Cindy Becker. This is our hope for you today. May Savings Time is here again with our annual cancer-free celebration. Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's BioNutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. We're back, everyone, having a great discussion with Dr. Matthews about vitamin D and health. Dr. Matthews, I'm kind of wondering now that we're really getting into vitamin D, and that is for us to really understand, and those at home to understand, what the healthy normal should be, not the 30 that we were talking about earlier in the show
20.
that's published.
You see that a lot.
But what's the real normal that you like to see most healthy or generally healthy people be at?
I like to see them between 40 and 60 nanograms per milliliter,
Okay.
and which is kind of more healthier dose than the 30. 30 is just not healthy,
Okay.
where you need
Not
to be.
enough.
Not enough.
Well, when we started really learning about vitamin D, I started supplementing, and I thought, and of course I just started self-supplementing because I know, right?
Yes.
So I was thinking, well, I'll take 3,000 a day because I want to get those levels up. I know I'm low. But, you know, doing a little bit more research, then I thought, well, I'll take 5,000 a day because I'm tall.
We
right?
hear all these benefits. I
We
want
hear
to take
these
more.
benefits.
Yeah.
Yes.
And then I thought, you know what? I'm going to follow the advice of the doctor, and I'm going to get it tested because I'm self-supplementing and I don't really know where I'm at. So I went and had it tested thinking, oh, I'm going to be just normal. And I, to my surprise, found that I was a little high.
It was 90,
So I
wasn't
thought,
it?
yeah.
Yeah, it was quite high.
And I work indoors. I mean, there's no sunlight in here. But that is a good point. I'd like for you to explain to everyone the importance of getting their level tested and kind of working with
Sure.
your dosing.
Yes, I'm a big proponent in getting your level tested. I think you should this should be a routine part of your physical exam once a year, and I think it should be under doctor's care. I always preface vitamin D with saying that you should make sure you go to your doctor and get your levels checked, let your doctor know exactly what you're doing, and follow your doctor's advice. This is a hormone, remember, this is not a vitamin, so there is a toxic level. However, I have seen more vitamin D deficiencies than I have vitamin D toxicity. I've never seen a toxicity.
Search the literature for vitamin D toxicity.
Yes.
There are very few cases.
Yes,
There
I've
really
not
are.
seen not any.
What is
Yeah,
a toxic
yeah.
level?
Toxic level anywhere between 100 to 150 nanograms per milliliter. And
Okay.
usually you start seeing things like nausea, vomiting, abdominal pain, mental confusion. You can get kidney stones with toxicity. But the problem is vitamin D deficiency is
Yes.
a problem. In medical school, we were taught that vitamin D toxicity
Is the big problem.
is a big problem.
Right.
However, we know that if you have a vitamin D level less than 18, in the annuals of medicine, they produced an article that says, like, if your level is less than 18, it increases your risk of death by 30% from all causes.
Yeah.
Wow.
All causes.
Yeah, amazing. So, are we to the point where we could say a typical man like me, 215 pounds, can you give a dose that I should take, or does it need to always be based on blood levels? Because honestly,
Sure.
not everybody's going to go to the doctor.
That's true.
But I want
That's
them to
true.
have the benefit.
Yes.
See, this is my dilemma.
Yes. I agree with you, but I still have to tell them
Yes.
they need to see the doctor. So if they don't see the doctor, they were told that they need to see a physician. Because thing is, it varies depending on, there are different things that affect your vitamin D levels. There are medications that affect vitamin D levels. Steroids decrease your vitamin D levels. Seizure
And trauma,
medication,
as you've
and
learned.
Trauma. Dark-skinned people have to stay in the sun 3 to 10 times longer to produce the same amount of vitamin D, so their levels tend to be 20 to 30% longer. Obesity, the vitamin D gets stored in the fat cells and not released into the blood cells. People in the Middle East, they wear the long burqas, so they're not exposed at all. Their vitamin D levels are very
Oh,
low.
they would be terribly low.
Yes, they're terribly
You know,
low.
and also if we're low in vitamin D, or excuse me, low in vitamin A, we're more susceptible to vitamin D toxicity and vice versa.
Yes.
So vitamin A and D work together.
Yes, they kind of
Yes.
sort of, and then also magnesium also. So if you're vitamin D deficient, you're most likely magnesium deficient also. So usually people need to take a low magnesium also, like 200, 250 milligrams of magnesium when you.
So does the magnesium make your vitamin D level stay higher?
No.
Or it just works together?
It works together and stuff, because basically hormones, what they do is they help move molecules throughout your body, just like you need insulin to move glucose.
Right.
You need vasopressin, which is another hormone to move water throughout your
Right.
kidneys. You need aldosterone to move sodium and potassium. So everything in your body is moved by some type of hormone. Hormone helps your body interact. So vitamin D moves calcium, magnesium, and phosphorus are the three things that it moves throughout the body.
Amazing.
You know, doctor, it would be an achievement of a great goal if I could help people never see you as a surgeon.
Sure.
And part of that is our daily lifestyle.
Yes, it is.
What we do on an everyday basis. Give us your recommendation. Now, this is the culmination of years of hard work and dealing with very desperately ill people. What should we be doing on a daily basis? You're 1, 2, 3. What do you recommend?
I think one of the major problems in the United States is lack of exercise. So I think most people need to just walk. Everybody can walk. You don't need a doctor's prescription to do that. Right. So then nutritionally, we need to all eat better. Eat more fruits and vegetables, and then I know I don't eat 6 servings of fruits and vegetables, so I take a vitamin supplement every day. I work 80 to 100 hours a week, and so I take vitamin D, I take a multivitamin, I take omega-3 fatty acids, and take turmeric, and so those are some of the things that I take to stay healthy.
You take turmeric. You know about turmeric. Tell us your experience with turmeric. And
it's an inflammatory agent, so you're working as a surgeon. I'm operating all day and all night, and so surgeons tend to get arthritis in the wrist, the elbows, the knees, and back and neck.
Plus, sir, you're under a lot of stress.
Yes, you're under a lot of stress. It's a very stressful job. So things in my job, I think having a great sense of humor, trying to get moderate amount of exercise, trying to eat right. I eat a lot of fish. I don't eat a lot of red meat. Every now and then I'll eat some red meat. But most things you can avoid just with just little simple things. I don't smoke, don't drink, and so just try to live a healthy lifestyle. I enjoy being a surgeon, but I don't like to be cut on.
No. Being the patient is not what I signed up for.
Not at all.
That's funny. Well, folks, we'll be back after these important messages for the wrap-up.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Dr. Matthews, you have a special interest in athletics, don't you?
Yes, I do.
What have you learned about how vitamin D can help the athlete?
Well, most athletes are vitamin D deficient too. Pittsburgh
Really?
Steelers actually tested their athletes, so did the New York Giants, and they found out 70 to 80% of their
Really?
professional football players were vitamin D
You
deficient.
think they'd have access to the best foods and the best nutrition and everything, wouldn't
Yes,
you?
I
And
agree.
they're outside.
You would think.
Yes. Well, you have to realize they have helmets on, they have
they're all
long
covered
sleeve
up.
jerseys, pants on, and so they're really not exposed. And most of them have indoor facilities now,
right.
so they don't get as much sunlight as we think. Then they found out in the study with the New York Giants and the Pittsburgh Steelers that vitamin D levels less than 30 nanograms per milliliters, they actually had more bone fractures, they were more likely to get cut, had shorter careers, had more muscle strains, more muscle sprains.
You know,
and all
this is
that.
amazing. As a football fan, I watch my favorite players, and they're constantly being injured.
Yes.
They've got to be paying attention to you.
Yes.
Okay, go on.
So as a result, I started working basically with my nephew back when he was in 8th grade. And Jordan Moore, he's a senior at LSU now, and basically won the Georgia State 5A Boys 110-meter high hurdle championship 3 years in a row. So then I started working with his high school football team, and so over the last 4 years, we've had 75 guys to get scholarships to college to play football off one team. So,
Wow,
yeah,
that
that's
is
unheard
impressive.
of. Yeah, that's
That is
unheard
impressive.
of. So they're doing well academically and athletically, and these kids are all big, fast, strong, powerful. They get injured very rarely. And their biggest problem is like trying to get playing time. So they seem to not be worried about getting injured or concussions.
Have
at
you
all.
noticed that the vitamin D therapy for the athlete, does it help them scholastically? Have you
Yes,
seen
it
that?
does. Yes, it does. Actually, they're doing well. Most of these kids, in order to be eligible to play college football, you have to have a certain ACT test score,
Sure.
a certain SAT score, and a certain GPA. So actually, the high school football team has a higher graduation rate than the general school. Which
That is impressive.
Yeah, I think they have like a
Absolutely.
98% high school
Mind, body,
graduation.
spirit.
Yes.
That's awesome.
Yes.
And you credit a significant portion of that to vitamin D.
Yes, because over the last 5-6 years, they've had 4 different head coaches. So each year they've had a different
Different
head coach.
methods,
Different
same
methods,
results.
different philosophies. And so the only thing that they had consistent was that they had like superior nutrition.
Yeah.
And the bad thing about this school is most of these kids qualify for free lunch, and they don't even have a decent weight room. So how do they get to be stronger than most kids
Well,
without
that's a
even a
good point.
decent weight room?
That's amazing.
Yeah, so-
What dose do you give them? Or do you base it purely on blood levels?
Well, actually, I tell the parents to take the kids to the doctor, get them tested. And so I do a lot of education with the parents. You know, you can't talk directly to kids, so you have to go through the parents, the coaches, the school, and stuff. So I educate the parents and educate the
Yes.
kids. So actually, the kids there are very sophisticated now. They understand I can get a scholarship, I can go to school for free, and so they've really delved into nutrition. Very few of them smoke, drink, or do anything else. And
You are truly doing good work, Doctor.
Thank you.
Now let's review real quickly. There are many of our viewers watching today with multiple health problems. Vitamin D deficiency is associated with what major health conditions? Review
Okay.
that.
First, I'd like to tell you that vitamin D deficiency is the most common nutritional deficiency in the world.
Oh, my.
Hands down, most common. So we cannot solve most healthcare problems until we address this 800-pound gorilla.
That's a good point.
Yeah. So
we
we-
got to do that first.
Yes,
so,
we do.
What else? Heart disease? What other conditions?
Heart
Name a few.
disease, cardiovascular, heart attacks, congestive heart failure, strokes, cancers, autoimmune diseases. There are 17 different varieties of cancers that are associated with vitamin D deficiencies. Joint pain, osteomalacia, osteoarthritis. So the list just grows longer each and every day.
Well, these are the conditions that we're all dealing with.
Yes, it is.
It's the everyday problem.
Yeah, and I would recommend the average person get your vitamin D level checked at least one time. Most people are surprised that their vitamin D levels are so low. And even among the physician population, they think since they eat, expensive food, steaks and all that.
Not much vitamin D in
There's not
that,
much
though.
vitamin D in it.
No, and milk is
Milk, yeah.
100 units per glass. You have
And
to
most
drink a
people-
lot of milk.
And most people are lactose intolerant.
Yes, can't drink the milk
You
anyway.
can't drink it. And so you only get 10% of vitamin D from your diet. And 90% of it comes from the sun striking your skin. Because I remember when I was at medical school, my nutritionist said, if you eat 3 healthy meals a day, you can be healthy. I was like, how can you be healthy when 90% of vitamin D comes from the sun and not your diet?
Dr. Matthews, thank you so much for joining us today.
Thank you for having me.
You know, you didn't even go into the operating room today, but you helped people.
Thank you.
And I thank you for that very much. And
you.
if I'm ever in a car wreck, I hope I'm in Atlanta and this man is on duty.
Thank you.
Thank you very much.
Thank you.
We'll see you, folks. Bye-bye.
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 Who is Mom? Mom knows the art of playing games. She can open things. She has the ability to translate 2-year-old talk. She believes in us and our dreams. Moms just do awesome, everyday, ordinary things.
This week on Our Jewish Roots, we examine the life of Paul, who went from persecutor to evangelist for Jesus the Messiah. We follow his missionary journeys as he traveled throughout the Roman Empire. And then Dr. Jeffrey Seif examines Paul's divinely inspired letters to the early church congregations. Watch for